In this lecture, we will cover blood disorders. First off, we have anemia, which is a decreased oxygen carrying capacity of the blood. Typical symptoms include pallor, which is pale skin, fatigue, weakness, and shortness of breath. Now, there are different types of anemia. So we have iron deficiency anemia, which is the most common type and the one that people are the most familiar with. Typically, when somebody says they have anemia or they know somebody who has anemia, typically they're talking about iron deficiency anemia. So, as the name implies, this is an inadequate dietary iron intake, or a reduced intestinal absorption of iron, or a slow blood loss. So we have lots of root causes of iron deficiency anemia, which is one of the reasons why it's the most common type. Several different things can ultimately cause this type of anemia. We can either supplement our iron intake, and that's probably the easiest way. Slow blood loss typically refers to menstruation in females, and so typically it's a little harder to just stop that, so we do supplement with iron pills instead. Now, pernicious anemia results from a vitamin B12 deficiency. We mentioned one of the things required for erythropoiesis was vitamin B12. We said it was involved in the process of mitosis. Specifically, you need vitamin B12 for DNA synthesis, so DNA replication. So if you remember the S phase of the cell cycle of and then leading into mitosis. If we do not have enough B12, it becomes harder to replicate your DNA as efficiently, and this includes those hematopoietic cells where we're trying to make more red blood cells. So we can give you B12 shots, things like that to supplement. Now, hemolytic anemia. Okay. Hemolytic, meaning heme means blood, lytic means to break. So now we are destroying your erythrocytes, which sounds terrible, and it kind of is. You are going to have erythrocyte destruction because of perhaps a bacterial infection, maybe a disease of the immune system, maybe your liver is not functioning quite properly, or even lead poisoning. Now, we don't typically hear about lead poisoning anymore, but back in the day, we used to have leaded gasoline. We used to put lead in paint. We used to put lead in a lot of things that weren't necessarily good for us. So if you, well, it's really hard to find leaded gas in first world countries these days, but if you were to rent or buy an older home, you have to have lead paint tests done to make sure that there's no lead in the paint, because kids, as cute as they are, they don't make great choices, and they will sometimes eat paint chips. They'll put them in their mouths, things like that, and if those paint chips contain lead, then those children could suffer from lead poisoning, and it could ultimately kill them if it goes on long enough. Now, aplastic anemia, we are inhibiting or completely stopping production of erythrocytes in red bone marrow. If you are unable to continue to produce erythrocytes, and you already know that erythrocytes only live for about 120 days, eventually, you would run out, and so that's not very good either. Okay, last but not least, we have sickle cell anemia. This one is genetic, first of all, so you either have it or you don't. It's the most common example of abnormally shaped hemoglobin molecules. So in our image, you can see our normal little biconcave blood cells. This is a sickled cell. This does not fit through blood capillaries very well, at least not as well as our normal shape. These tend to get stuck, causing clots and other bad things to happen. You'll hear people complain of sickle cell crises, and it's pretty painful. If you inherit one copy of this disorder, then you would be termed a sickle cell carrier. You would have the sickle cell trait. So you would be asymptomatic. Okay? If you inherit 2 defective copies, then you would suffer from sickle cell anemia in your erythrocytes. Most of them would look like that. Since it is genetic, there is no cure for it. We have better treatments than we used to, but people with this condition do suffer from this their entire life. Okay, polycythemia is an excess of abnormal increase in red blood cells. So now you have more RBCs than you normally do. And this is especially one of those times where that common phrase of, more isn't always good or more isn't always better comes into play. Because at first you would think, oh, well, that'd be great. I would be able to carry more oxygen, especially maybe if you were an athlete. It could increase your endurance, things like that. But unfortunately, there's also a downside. Your red blood cells are really one of the things that give your blood viscosity. And so the more red blood cells you have, the more viscous your blood is. The thicker your blood is, the harder it is to move through the vessels. This increases your blood pressure, which is obviously bad, and it could also contribute to thrombosis and hemorrhage, putting too much stuff in your blood. You do have a couple of different reasons why this could happen. One of them could be bone marrow cancer, so maybe your red marrow is just cranking out red cells. Okay, you could be blood doping. So athletes do this sometimes. They will take artificial erythropoietin or EPO and crank up their red blood cell production. Again, their goal is to increase oxygen capacities so they have increased endurance so they can win their race or their meet or whatever they're competing in. And then last but not least is a response to living in higher altitudes. So Denver, for example, is the mile-high city. It literally is a mile up in the air, where oxygen is a little less voluminous in the air that we breathe. And so your body has decided, well, I can't really make the air have more oxygen. Can't really do anything about that, but I could at least maybe up the amount of red blood cells that I have, and so the oxygen that I do come across, I can grab onto as much as possible to sustain me. So that one is just a normal response to an environmental condition. Then we have leukemia. Leukemias are cancers of the blood or the bone marrow. There are a couple of different varieties of leukemia. One way we can categorize them is whether they are acute or chronic. So basically, how does the disease progress? Any type of acute leukemia is a rapid increase in either immature or non-functional or poorly functional blood cells. But then a chronic leukemia would be a slow accumulation of those abnormal mature leukocytes instead. So one occurs very quickly and one is just more slow acting. We could also categorize leukemias based on the type of cell line that they come from. So you have lymphocytic leukemias, which come from lymphoid cells. Typically these are abnormal B lymphocytes or B cells. Or then you could have myelogenous leukemias from the myeloid cell line, which could really involve any of the myeloid cells, so your other leukocytes. And then we have acute lymphocytic leukemia, which is the most common in children, unfortunately. So your abnormal cells that are accumulating are crowding out your good marrow, and this reduces your ability to make healthy cells. Eventually those cancerous cells will enter the bloodstream and it'll spread to other tissues, and we know that as metastasis. So that one's extra nasty. Alright, a couple more blood disorders. We have leukopenia, which means your white blood cell count is too low. Patients with leukopenia, perhaps you are taking a corticosteroid, which suppresses your immune system. We do this for people that have undergone organ transplants, so we can reduce the likelihood that their body will reject their new organ, and even some anti-cancer drugs. So one of the stinky things about cancer drugs is they don't always have a good way to specify what types of cells that they destroy. And so one of the negative side effects of a lot of anti-cancer drugs and treatments are they kill a lot of good cells as well. Then we have infectious mononucleosis. A lot of people know this as just simply mono. This is caused by a virus, specifically the Epstein-Barr virus. This is an accumulation of agranulocytes, so our monocytes and our lymphocytes. And the classic symptoms of this are tiredness, aches, sore throat, and low-grade fever. And if you've ever heard of mono, maybe you've suffered from mono, maybe you know someone that has suffered from mono. When we say tired and achy and all that, we're really talking about extremes. It's not uncommon for people suffering from mono to be somewhat bedridden just from exhaustion. You know, I personally know somebody who contracted mono, I want to say twice, and she ended up having to be homeschooled for several months because it just wiped her out. Like, she would just be so tired that she wouldn't be able to come to school and things like that for several months at a time. Now, leukocytosis is an excessive white blood cell count. So this is one of the first indicators that you could have an infection. Okay, this isn't overly specific. So notice we just said excessive white blood cell count. If we notice that your white count is up, then we can do further diagnostic tests to figure out which white cell and what could be the root cause of that.